DentalFuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. DentalFuel brings you the unspoken in between. DentalFuel is brought to you by Ignite DDS Coaching, empowering dentists to build self-determined futures. Together, we're shaping the next generation of leaders in dentistry. Welcome back to DentalFuel. Ladies and gentlemen, the time has come. This indeed will be our last guest. It has been so fun to bring you mistakes from industry leaders. I know I have learned a lot from them, and I hope you have too. Our last guest is the Justin Moody. Justin Moody is a dentist specializing in implant dentistry in Arizona. You may know him from Implant Pathway. In this episode, we talk about a clinical mistake. Dr. Justin Moody, welcome to DentalFuel. How are you doing today?
I am great. Happy to be on.
Super excited to have you here at DentalFuel for our listeners to listen to your story and to learn more about you and all the cool things that you're doing in Arizona.
Happy to be here.
As we get into it, I'd love to know a little bit more about yourself and what exactly are you doing in Arizona?
Well, I'm a fifth generation ranch kid from Nebraska, so I don't have a dental history, other than the time that I've been. My dad and my brother still work and operate the same cattle and wheat farm that has been in our family since 1883. So I'm new to dentistry as far as generational, but I've always enjoyed. I enjoy helping people. I think the more people I can, help, the better. I have a real passion for teaching. My mom was a high school math teacher, and so I think I got a little bit of my love for teaching from her. And along the way, I had some great mentors that got me into implant dentistry. And the implant dentistry is my passion. So I graduated from the University of Oklahoma in 1997 as a dentist. I moved back home to my little tiny town in western Nebraska called Crawford, Nebraska, home to 1,100 people. I was one of 16 people in my high school graduating class. So there's you're talking to 1/16 of my graduating class. And I went to work. I bought my childhood dentist's practice, and I went to work in a very general dentistry setting. My mentor, a guy named Roger Plooster out of Lincoln, Nebraska, I used to go down to the football games in the fall at the university, and I'd stop into his office, the day before and catch up. And he was always doing implants, and he's just like, how's it going back home? Because he was from my hometown as well. And I was just like, man, there's a lot of removable. I said, I think Doc Jerry, my childhood dentist, I think Doc Jerry, I think he had dentulated, half the county, and a lot of denture adjustments, partials and things. And he's like, man, he goes, if you don't get into implant dentistry, he says, like that removable stuff it's gonna beat you down, and you're not gonna enjoy your job nearly as much. And I was just like, well, I don't care for those appointments, to be honest. And he said, well, he goes, it's not as much about you not caring for those appointments, but the patients don't understand why their dentures don't fit, and the only logical solution for them is, it wasn't made right, or they don't fit, and he said the reality is, the patient doesn't understand that once we lose our teeth, the bone and the tissue and everything, starts to melt away, without stimulation. He said, so, putting just as a couple of dental implants and holding their lower denture in place, you'll literally change someone's life. And so I, at the time, the only place that you could learn implant dentistry was from Carl Misch himself, from the godfather of implant dentistry. So I took 7 weekends of courses up in Detroit, Michigan, to learn from him. And when I went home and I started literally changing people's lives, it's over the course of the years, like it's all I really wanted to do. And then I became like this, like this rabid dog for implant continuing education. Like I just took everything that I could possibly take. I took every one of Carl's courses, and Michael Picos's down in Florida, and John Russo in the Carolinas, and like I just went everywhere. And and it became something that I love to do, and it wasn't fillings and hygiene checks, and denture adjustments. And it kind of went that way until about 2010, when I wanted to make this switch. And I was like, I really just want to do implants. And people was like, yeah, but like you got this general dentistry. And I was like, well, like, I think one of the problems we have in dentistry today is that, you're probably familiar that they say upwards of 85% of all associateships fail. And, that sounds like, well, why would that be? Well, in implant dentistry, and now having taught it, there are people that get excited about implant dentistry, like myself, that's really all they want to do. And then they say, well, you know what, like I'm going to bring in an associate, and, they can do everything else, and I'll just do the implants. And if you really step back and think about that statement, like, I don't want to do any of that other stuff, so I want to bring someone else in to do it. Well, they don't want to do that either. Like they don't want to do it all day long. So I decided that it's like I'm going to bring in an associate, but I'm going to actually leave that practice, and I'm going to move to Rapid City, South Dakota. So I went from 1,000 people to 100,000 people. And I hung my shingle out as an implant-only office, and as a referral office. Like I went out and I talked to every dentist. I did lunch and learns, like, send me your implants. I'll send them back, impression ready, like crown ready, whatever it looks like. And, over time, people discovered that I was restorative driven. Like the implants were in nice positions. They were easy to restore. And I started having I had great success, and I built a nice practice, and it was so much different, without hygienists and restorative. Like I had one front desk, and I had one surgical assistant and me, and we had a very bare bones practice that was incredibly profitable. And along the way, BioHorizons, the implant company, said, hey, like, what a great success story, like for implants, would you mind, like, I remember the very first thing I ever did was they sent me to Albany, New York to do a oral surgery group study club, talk to them about, like restoring implants. And I remember, like, I was so excited, I did it for the air flights and the hotels, like it had nothing to do about money. And I went up there, and it was from Rapid City, South Dakota. Like I had to leave on Thursday, and I was a 5-day a week dentist, so I had to leave on Thursday. I got there Friday, I hung out all day. I did the Friday night, study club, and then I couldn't get home now until like Saturday. So like 3 days for this like 3-hour event, and like it was still like one of the greatest. And I still am friends with some of the people that I met. I think that was in like 2013 or something like that, and they just started using me more and more. And as my friends, would talk to me, and they're like, hey, listen, like you're good at that, and like, yeah, because you do it for a living. And I was like, yeah, I guess so. And so I took this kind of like, some people call me a risk taker. My dad calls me a serial entrepreneur, like, whatever it is. But I was like, what, like I can do a lot of implants during the day, but how many implants could I help people get by teaching people to do this? So in 2015, I created Implant Pathway and started teaching across the country and wherever that I could. And then in 2017, I moved here to the greater Phoenix area, and we found a nonprofit clinic that we could do live patient training on, so that the doctors that learn could literally get some reps under direct mentor supervision to be able to go home and actually do them. And I think I've been talking too much, so that's that.
No, this is great. No, I'm learning a ton. Well, you just, from what I'm listening to, is that you kept going to cities with growing populations.
Yes, implant dentistry is, a smaller niche in, in the modalities of dentistry, and, back in a town of 1,000 people, like there's no shortage of crowns and fillings and, things like that need to be done. But like, there's, not every human that walks in your door needs an implant, but every human that walks in your door needs their teeth cleaned twice a year. So like, to do more implants, like you do have to get to a bigger patient base, to make that happen. So I am quite a ways away from Crawford, Nebraska.
Absolutely. So Justin, I'm curious. I'm sure that in your journey of implants, you have seen maybe some challenges and mistakes along the way, maybe from yourself or maybe from those that you have taught. I'm curious if you have one of those clinical mistakes in mind that you would like to share, and how you managed it and how you encourage the students that you teach to manage it.
I think there's a lot of challenging cases, out there. And, I got, seems like a lifetime, 27 years of, cases that you could talk about. But I think the biggest challenges that we face today in dentistry is managing the patient that needs to be edentulated. And that we lose our teeth for a number of reasons, right? Like it could be trauma, but that's not that common. Accidents happen, but we usually lose our teeth either due to periodontal disease or caries. And you could have a combination, but generally, like speaking, like if you lost it from perio, like because they're two different situations, right? Like you have a situation where you have a high bacterial load and you have radiographic bone loss. So you are already at a deficit for bone. And those are challenging cases because of the bacterial load, and B, oftentimes, inadequate bone for what we would like is, ideal implants. But I want to talk, like, maybe the most challenging case we have today, or cases, is the patients, the younger patients that are losing their teeth to caries. And, when I was in dental school, I had a few of these patients, and the patients, I tell you who they were. They were night watchmen and night desk people at buildings, and they sat around all night long with a giant big gulp of Mountain Dew, just like bathing their teeth, and then so they would lose their teeth by caries. And the issue with implants and full arch and people that lose their teeth by caries is that they have bone. Oftentimes they have too much of it for what most people think about in full arch dentistry as this big zirconia FP3 prosthesis. And there's a lot of centers out there that try to treat everybody in the same, like with the same cookie cutter, and that is, okay, we're going to dentulate you, we're going to do alveoloplasty flat, we're going to put our implants in straight, tilted, whatever you believe, and then we're going to make them this big zirconia bridge. But in 27 years, and most recently probably full arch in the last 10, like, what the challenging cases are those that are younger individuals that we lose this teeth, and we do this, and this implant dentistry is not forever treatment. Like I cannot guarantee you, nor do I expect to be able to edentulate someone and put them into a full arch prosthesis and have it be there for the rest of their life. Like, it's really, it's a disservice, and it's not actually factual. And what people forget about is, like, yeah, it's expensive and you're chasing the dollars and stuff, but what we forget about is that the patient lost their teeth for a reason. And like the reason is they didn't take care of them in some function in some avenue. And so you take someone that is historically poor at taking care of their teeth. We edentulate them, we put them this prosthesis in there, and then we expect it to last forever when, God gave us teeth that could for the most part last us our lifetime if we take care of them. So in the younger person that loses their teeth to caries, the challenge I see today is like teaching doctors how to do what we call an FP1 prosthesis, which is not removing the bone, but like putting the implants in the correct positions for the prosthesis to be lower profile and being able to preserve that bone. Because if I do this on a 30 or a 40-year-old, like in 15 to 20 years, they're going to have it. They're going to have a revision. They're going to have it redone. And at 60, there's a chance that you may need to have it redone again if you live to 70, 80, 90 years old. And if I took away all the bone in your 40s, I don't have any other options when you become 60 or 70 years old. So like the challenge I have today and trying to, and I've got some great mentors here, Josh Nagao, Wade Pilling, like that have stepped up to teach these FP1 courses that talk about bone preservation and having, like planning for the next phase of their dental life. And I'm also really blessed to be able to have a faculty member named Dan Holtzclaw, who is a periodontist out of Austin, Texas, that specializes in remote anchorage, like zygomatic implants, pterygoid implants, transnasals. And his job is to take those that have had failed prosthesis or didn't get to us implant wise until they already lost all their bone. And the only option is for these remote anchorage things. So that's probably the most challenging thing I think we have in implant dentistry today, is dealing with early loss of teeth.
I'd like to backtrack a little bit on the conversation that you were having on finances. And I know, it can be very expensive for patients to get implants, but the investment in, learning to place implants as well too, and maybe not knowing where to go can be very high. And of course, financial issues whenever somebody's starting their own practice, that also comes to play. So I'm curious of, your thoughts and your experience with any financial mistakes, but also on the flip, especially you who is very cognizant in helping the general public and maybe those who are underserved, helping those who may not have the traditional means of financing implants, giving them the ability to get implants.
All of us as dentists, I would love nothing more than to be able to treat my patients that walk in the door with the treatment that I would want for myself if I was in that position. The reality of life is like we all have to live within our own financial means, and this stuff's expensive. Mm-hmm. Like implant dentistry is expensive. So how I see patient financing is like, and I think sometimes the younger dentist, has a tougher time coming out of school, and I'd be interested to hear your opinion. I know you're in community health, and so like a lot of the things that you do are very similar to what we do at our nonprofit here. Is like we have the ability to help so many more people because the live surgical training that we do with the doctors that come here, when they come here on the Arizona restricted license, allows us to take care of these patients at no cost. So like the patient, maybe they may be able to get their extractions, alveoloplasty, grafting, and implants at no cost. Because really, what is happening is that, like, we have donations from companies like BioHorizons that give us the implants and the bone and the other things, and other corporate sponsors. But really, what we do is we use a good portion. It's sometimes depending on the course, but sometimes it's over 50% of the tuition that the doctor is paying to come here actually goes directly to the clinic to pay the DAs, to help in the prosthesis that the patients may have, and our fees are much lower for the prosthesis for this clinic too, because even if you got the surgeries for free, a $10,000 restoration is like too much for most people, right? So we offer I think we're $1,250 for a implant overdenture on like locators, and that's what I think. There's a lot more people that can get into that, and than you could, out in the private sector. And it's interesting. It's like we don't compete against the general dentists here in town. We're not taking their patients, because these patients we see, like, they either went and couldn't afford it, or they didn't go because they know they can't afford it. And we're filling that void. And there's not a lot of scenarios in life where there's no loser, right? Like we're a nation of watching sporting events. Well, every one of them ends with a winner or a loser, but here we have the opportunity to provide care to patients that would never, ever be able to afford the kind of appropriate and ideal treatment. We have the ability to take a dentist and provide them a skill set and real reps on a patient under direct mentor supervision, so that when they go home, they have a much better understanding of and confidence in doing the procedure. And third, the winners are, we employ 33 people over in the clinic. And we all get to, I make my living on, training in my private practice, but the clinic and the doctors that work over in the clinic, they get paid through the tuition dollars and through whatever the restorations are, that the patients pay for. So there's everybody wins. And, I've migrated, from Nebraska to South Dakota to down here, but I don't have anywhere else to migrate, because I don't know how I could serve people better than I'm already doing right here.
Thank you for tuning in to this first episode with Dr. Justin Moody. Join in next week where we talk about a financial mistake. Ready to take the next step in your journey? Book an intro call with Ignite DDS Coaching today and level up your future in dentistry.